Okay, so this is my audience. Yay. And the photographers, videographers.
Okay.
All right.
Okay, so
All right.
thank you.
I'm fat because I am lazy and I lack discipline. I did this to myself. That is the prejudice and discrimination that faces people who are obese. Today I want to talk to you about bariatric surgery and convince you as to why insurance companies should not be allowed to exempt coverage if the surgery is medically necessary. I know that some of you may agree with my first statement regarding obesity, and I want to convince you otherwise. Those of you that understand there are more factors involved that lead to obesity, I want to inspire you to stand up for yourself, a loved one, or a friend that may be dealing with this prejudice. As you can see, I wasn't a fat kid. When I hit puberty, I started putting on weight, and so for the rest of my teenage years, I spent fighting off about 20 or 40 pounds. By the time I turned 19, I'd endured the good, the fad, and the ugly. In my early 20s, I was a self-described gym junkie. I went to the gym about 5 to 6 days a week, and then I became ill with many bouts of tonsillitis, and it took its toll on my body. I complained to my doctor about being tired all the time, and that no matter what I ate or didn't eat, I kept gaining weight. She told me to exercise more. Within 2 years' time, I gained 100 pounds. My doctor had become concerned with my blood pressure, but not the rapid weight gain. So let's talk about the causes of obesity, risk factors, and the comparison of treatment with other diseases. As in my husband's family, genetics play a role in obesity. According to the CDC, obese individuals have genetic similarities. This knowledge may be useful in preventing or treating obesity in predisposed people. Illnesses such as metabolic disorders, endocrine disorders, and sleep disorders also attribute to the cause of obesity. The Surgeon General's Vision for a Healthy and Fit Nation from 2010 states that stress is also another contributing factor to being overweight and to obesity. You may or may not be surprised that the World Health Organization's March 2011 fact sheet states that children in low and middle-income countries are more vulnerable to inadequate prenatal, infant, and young child nutrition. At the same time, they are exposed to high fat, high sugar, high salt, energy-dense, micronutrient-poor foods, which tend to be lower in cost. These dietary patterns, in conjunction with low levels of physical activity, result in sharp increases in childhood obesity. I've told you about some of the possible causes of obesity. Let's talk about the risk factors involved in being obese. According to the Mayo Clinic, Medline Plus, and the National Cancer Institute, the following are some of the risks of cancer: heart disease, type 2 diabetes, stroke, high blood pressure, and certain types of cancer. The National Cancer Institute cited that about 3.2% of all new cancers are linked to obesity, and that obesity and physical inactivity may account for 25 to 30% of several major cancers. A March 2011 fact sheet from the World Health Organization website also states that at least 2.8 million adults die each year as a result of being overweight or obese. So what do we do as a nation about obesity? Currently, the only screening for obesity is family history. Being overweight or obese increases your risk of certain cancers, including breast cancer, yet prevention of obesity has not been fought with as much intensity. In her article, The Emerging Evidence About the Role of Obesity in Cancer from November of this year, Dr. Rachel Ballard-Barbish states that despite decades of research indicating a strong association between obesity and cancer, incidence and prognosis, obesity's contribution to cancer has been widely recognized only recently. The Surgeon General also acknowledges the concern over obesity. Obesity poses a major public health challenge. Each year, obesity contributes to an estimated 112,000 preventable deaths. Each year, obesity, so this is what I'm asking them. Why is the only PSA I've ever seen the NFL play 60? I refer you back to my original statement regarding the social stigma of obesity. People believe I'm fat because I'm lazy, I lack discipline, I did this to myself. You may be saying to yourself, all these people need to do is just eat right and exercise. Well, an article just updated November 26th of this year from the UCSF Medical Center states there are countless weight loss strategies available, but many are ineffective and short-term. Among the morbidly obese, less than 5% succeed in losing a significant amount of weight and maintaining the weight loss with non-surgical programs. A study published by the National Center for Biotechnology Information from 2009 states that bariatric surgery appears to be clinically effective and cost-effective as an intervention for moderately to severely obese people compared to non-surgical interventions. So if you end up being one of the unlucky 95% that have found yourself obese and unable to lose weight with diet and exercise alone, what do you do next? You look into bariatric surgery, and you hope that your health insurance company will help cover part of the procedure. According to the contract for our current PPO for Blue Cross of Idaho for state employees, the following are listed as exemptions of coverage. For weight control or treatment of obesity or morbid obesity, even if medically necessary, including but not limited to surgery for obesity. For surgical removal of excess skin that is the result of weight loss or gain, including but not limited to an association with prior weight reduction surgery. Billing codes for obesity have been around since 1997, but a billing code doesn't mean the insurance company will pay for the services billed. Blue Cross of Idaho covers treatment of the illnesses caused by obesity, but does not participate in aiding in the prevention of the source. The quotes that you just saw are from the American Academy of Family Physicians and indicates that this is not uncommon for insurance companies. So today I've talked to you about the growing problem of obesity, the health risks possible, and the treatments available. I hope this causes you to change your opinion for the medical necessity of bariatric surgery. No one deserves to lose a friend or loved one to a preventable death. How would you feel if it was your child or your parent that was obese? You knew their only effective treatment was surgery, and they were denied treatment due to lack of insurance coverage. Would you act? I've heard people complain that obesity surgery is an easy out or a quick fix. As someone that's watched their spouse go through it, I can tell you it isn't a quick and easy fix. If there was a surgery that came out tomorrow that caused smokers to quit craving cigarettes, smokers would be signing up for it left and right. Would they be judged and looked down on for taking this opportunity? If their insurance companies wouldn't pay for the surgery and people continue to die from lung cancer and other diseases caused by smoking, there'd be an uproar. When you leave today, I'd like you to read the Surgeon General's report regarding health and fitness. I'd like you to try and start a program in your community to aid future generations from becoming obese. Or please come talk to me about how to pass laws similar to the laws regarding the insurance coverage of cancer treatment and plastic surgery for people who've had mastectomy. In my research, I came across a quote that basically says it all, and it's from Iowa State Senator Tom Harkin. He said, "Let's face it, in America today, we don't have a healthcare system, we have a sick care system. We wait until people become obese, develop chronic diseases, or become disabled. And then we spend untold hundreds of billions annually to try and make them better." And they're still here. Okay.